Hi everyone, Dinesh Sarasena here, and today we're going to be talking about injections into the iliopsoas tendon. As with my previous video about imaging the iliopsoas tendon, I tend to have the patient lying in a supine position with the hip exposed and their dignity preserved with a towel. Depending on the habitus or the muscle bulk, you may want to extend the hip more by lowering the bed, and this brings the structures of relevance into a more superficial position. When injecting the iliopsoas tendon, I tend to use a linear transducer. Ideally, if you have one that is lower frequency, I would suggest using this because it will allow you to see the structures much more clearly. I tend to do the injections in a short axis orientation. You can either do a in-plane or out-of-plane approach. Here we have the in-plane approach. So I approach the injection from a lateral orientation using an in-plane technique, and I'm aiming the needle approximately 45 to 50 degrees, depending on the habitus of the patient. Remember, you may need to have a slightly longer needle due to the depth of the injection. An alternative is to use an outer plane technique. Now, this can be a little bit trickier. However, because you are doing an outer plane technique, you will generally traverse less tissue and it will be much more direct in and around the iliopsoas tendon. When doing this, you want to have the needle as perpendicular to the skin as possible and as close to the long axis or long border of the transducer. When using the outer plane approach, you might not see the needle until it's right at the iliopsoas tendon. In both situations, if you're doing a steroid injection, you want to place the steroid near to the iliopsoas tendon. Whereas if you're doing a PRP injection, you will want to place the PRP in the iliopsoas tendon itself using a fenestration technique. Typically, the long axis orientation is somewhat more challenging because you have a lot longer distance to traverse and it will be somewhat more challenging to achieve. Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal ultrasound imaging and interventions. If you did, please remember to hit the like down below and subscribe to the channel and share the video with your friends and colleagues. You can also follow me on Twitter and Instagram. And remember to check out sportsmedinfo.sg. Thanks again, and I hope to see you all very soon.